Thank you.
We're going to call the meeting for Reimagining Public Safety to order. At this time, I'm going to ask if the clerk will read the roll.
Taylor,
Aye.
Connor,
Aye.
Freeman, Fusco, no, I saw him join. We'll come back to you. Holland,
Aye.
Hamer, Lombardo,
Aye.
McKittrick,
Aye.
Malik,
Aye.
Neal,
Aye.
Amobian, like she is here, but not at her computer. Samples,
Aye.
Somerville,
Aye.
Fusco,
Aye, thank you.
Freeman.
Aye.
He joined. Oh, he is here. So we currently have everyone except for Councilman Kamer, and Councilwoman Amobian is not at her computer.
Okay, thank you so much. So we're going to go ahead and get started. On this afternoon, we're going to be having a conversation about community responders. And so I want to take an opportunity first. I want to thank Councilman Malik for helping us to set up our presentation on this afternoon. Want to take an opportunity to introduce our special guest and just thank them for taking the time out to share some really important information with us this afternoon. So online with us, we do have Betsy Pearl, who is the Associate Director for Community Justice Reform at the Center for American Progress think tank in Washington. We also have online with us Amos Irwin, who is Program Director for the Law Enforcement Action Partnership. We're also fortunate to have online with us retired Assistant Chief Tom Thompson, who previously served with the Miamisburg, Ohio PD and the Kettering Health Network PD. So again, I want to take an opportunity just to welcome all of our special guests this afternoon. And also just wanted to share with council that both Betsy and Amos co-authored a report regarding community responder programs. And so we're going to make sure that that report is sent out to all of council members just so that you have the opportunity to review that. And also just want to acknowledge that all three of our presenters on today are working with communities across the country, communities the same size as Akron, and setting up these types of community responder programs. So just want to thank them for all the work that they do. Also, Councilman Malik, I don't know if you have any opening remarks before we move into our discussion.
Thank you, President Somerville, and thank you for our guests. I think, this is something we've talked about previously in our Reimagining Public Safety working groups, is the idea of, having mental health and social service folks involved in 911 calls in some way, right? Whether that's being a co-responder when a call comes in or alternative responder for some calls. And we wanted to continue that conversation as part of our broader Reimagining Public Safety work that President Somerville has set out. And so, this is about, I'll let our guests actually do the presentation, but this is about two things: having the best response possible to each call so that we ensure that if it's a social service call that doesn't necessarily need an officer, or it's a mental health call that doesn't necessarily involve any danger, that we are sending the best person to have the best outcome. And then also, along with that, we know the staffing challenges that our police department has with over, with around 250,000 calls for service a year. If we can take 5% or 10% of those calls and reduce the officer time that's needed for those calls, or reduce that an officer is needed entirely for that call, that frees up those officers to work on gun violence, to work on other community priorities like community policing. So anyways, I'll let the guests get into it, but want to acknowledge that the administration has also been working on this. And I think we'll be sharing information in due course as well. But I think what we're hoping to do is have an ongoing conversation on council, but also in the administration. So with that, we'll give it over to Amos or Betsy if you want to kick it off. Or Tom.
I think we'll put Tom in charge to start, but thank you so much for having us. Tom, are you on?
I'm here and now I'm unmuted. So I was just gonna say I'd kick it off. So I am Tom Thompson, and the healthcare institution I was a part of was a big healthcare network in Southwest Ohio. I had about 170 officers there. We're here to discuss how establishing a new branch of civilian first responders for police calls for service can help reduce over-reliance on the police. And I am with Amos from LEAP and Betsy from the Center for American Progress. So I do want to get to these panelists as soon as possible, but this issue as an officer and a member of the community is personal. And we're here because of what our officers, including myself, have experienced firsthand. So some ask, not as many ask as they used to, why do we need civilian responders? So I'm going to give you a couple examples. So if you think about this is a pretty significant stat. There's as many as 800,000 law enforcement officers in the United States. And I would say the vast majority of those officers have been a part of, or they have witnessed at least one encounter with a person suffering with a mental health disorder that ended up in a use of force, up to including serious physical harm or criminal charges that could have been avoided by sending an appropriate responder. And I can say at least one. I've seen many encounters that could have had a better outcome, and other officers I'm sure would say the same. So if 800,000 law enforcement officers have witnessed this, that's an enormous amount of harm to our society that probably happens each and every year. The 8-hour mental health first aid class that officers are given, or the 40-hour CIT class, does not adequately equip our officers to be able to intervene in a mental health crisis. And I've seen this on display dozens and dozens and dozens of times with behavioral health patients in the healthcare world. And if you need any confirmation on what I'm telling you, if you asked an officer and they were honest with you, they'd tell you we're not equipped. I have another example for a civilian responder. I've responded to civilian complaints or code violations that could have used a more appropriate non-uniform response. For example, I remember handling a parking issue, which one neighbor parked in front of another neighbor's home. Not a crime, not a parking violation, just parked in front of their home. So by the time you're done speaking with both parties, I've taken an hour of time. That's an hour which could have been spent proactively patrolling, doing a criminal investigation, building relationships in the community. And furthermore, by the time you're done with that hour, usually both parties are upset with you because neither get the answer they want. And you get the police don't do anything when you call, so why do we call? So, thereby it really damages not only our officers' credibility, but accessibility, and especially when criminal investigations are necessary. I'll go ahead and turn this over to Betsy.
Thank you so much, Assistant Chief Thompson. Really appreciate you sharing those experiences. And really, we do see those experiences that you've shared play out in the data. That really, too much of the time, police are spending their time on calls that don't necessarily need an armed police response. So as part of the report that President Somerville mentioned that we published in 2020, we did an in-depth analysis of 911 calls for service in 8 cities across the country of different sizes and geographies, where 911 data was publicly available. And we use that data to take a look at the volume of different types of calls to 911 over 1 year, the year 2019, to understand what really makes up the bulk of calls for service. And what we found is that a relatively small percentage of calls are actually considered high priority. The type of urgent calls that need an immediate response, where perhaps an active crime is in progress. But really, most of the calls were classified as either low priority or medium priority. And if you take a look at the slide up here, a great example is another Midwestern city, Detroit, where I think it's around 40% of the calls were considered low priority in 2019, and only around a quarter were classified as high priority. And if you look at the data that we have up here, we really did see sort of a fairly similar distribution across other cities as well. And now, what exactly do we mean when we say a low priority call? So unfortunately, every city codes its 911 calls a little bit differently. There's no common coding or parlance across jurisdictions. So call types are going to have a different name in Akron than they are in Seattle or Minneapolis or Hartford or whatnot. But regardless of what we're calling a 911 call, we saw pretty common threads in the types of incidents that police are spending their time on that they don't necessarily need to be. So for example, we saw a significant portion of time spent on low priority calls that were coded as disturbances, which is just a really broad category of incidences that could include disorderly conduct or a vandalism report or a neighbor-tenant dispute. So if you look at Detroit, those types of disturbances make up almost 15% of the 911 calls that came in that year. And then you see other low priority calls that are pretty common. Noise complaints, calls about an intoxicated person or a mental health crisis, welfare checks, other kind of non-criminal concerns that the police don't really need to be the first response to. And I'm going to turn it over to Amos now to speak a little bit about the data that we're seeing more recently out of a city that is fairly similar in size to Akron, not too far down the road, Dayton, Ohio.
Thanks, Betsy. So here, this slide that we put up shows analysis that we performed for the city of Dayton. We worked to design a community responder model for the city of Dayton, and as part of that, we did an analysis of their calls for service just for 1 year. And this is sort of just 6 categories of those calls, and you'll see that in the top, a very large percentage of the calls are taking reports based on things that happened in the past, which is largely for insurance purposes, was about 29% of the calls. Many calls that come in, it's somebody broke my car window, or there was a minor accident, no injuries, but we just wanted to call because Geico tells me to call. Low risk issues around whether it's mental health services, minor conflicts, that was about 23% of calls, where there is a situation that needs someone to respond, but it's not not necessarily something that an armed officer needs to show up to. Then there are disputes where it's need to make sure the scene is safe, but ultimately it's not a criminal issue. It's more of a, these two people are having a heated argument type of issue. And that was another 15% of calls. Then there were calls around suspicious person. There were calls related to alarms and high risk or, issues that are purely clear police issues. Were only 19% of the total calls that are coming into police. So this was just, a snapshot of what we found looking at Dayton's data, with the main point here being a whole lot of those calls don't necessarily need to be on the police's plate, and we'll come back to that. So I wanted to mention briefly what other cities are doing when it comes to, this, what we call a community responder model. What is that? So if you think about, if I call 911 in most jurisdictions across the country, if I call 911, if it's not for EMS or fire, it goes to police. So yes, there's a lot of issues that do need a police response, but the police are just the default. They're getting all this stuff that does not need a police response. And Betsy was showing you some concrete examples of some of the major call types that often contain these low risk calls that don't necessarily need a police response. And so basically, in simplest form, this is a call comes in that doesn't need to go to police or EMS or fire. So it can go to a team of 2 trained civilians to show up to the call. Now, who would be the best individuals for that job? It depends on what types of calls the jurisdiction is facing. So it could be different from one place to another. But in many cases, as you can see, a lot of the common needs are around mental health, but also services. There are a lot of calls relating to addiction. There are many calls relating to homelessness. There are many low-level disputes. I can't get my kid to get up and go to school. There's a noise complaint with the neighbor next door, landlord-tenant dispute. There's a lot of different skills that can be helpful here. And so you have these 2 trained full-time civilians who are on a team who show up to the scene and try to resolve that situation and try to refer people to services as appropriate, so that you're not just putting a Band-Aid on the situation, but you are dealing with it long term. And one thing that, now this is a very busy diagram, but one thing that you'll see right at the top where it says incident occurs, there are 2 different options. You want to make sure that if the person calls 911, be community responders. You also want to make sure that the person doesn't have to call 911, because many people don't want to call 911. So how do I get to the community responders? Through a different, what we call a direct line. So that's the main point here, is that you can either call 911, and if it's appropriate, get directed to the community responder team, or call the direct line to get responded to the team. And what we find is, there are many other similar programs out there. So I think the important things to keep in mind when we're talking about community responders are, it's a program that involves, 911 calls are able to be sent to these civilian responders. They don't have to call some, a special hotline or something that the vast majority of people won't remember to call. And that this is a team of 2 civilians. It's not a co-responder team with 1 officer and 1 civilian. There are calls that are appropriate for a co-responder team, and there are calls where you don't need an officer there. Now I will turn it back to Betsy to talk about actually, you know what? I'm going to turn it over to Tom. Tom, I will let you talk a little bit about the biggest concern that people have when they first hear about this type of an approach.
Thank you very much, Amos. And I can say, as a career law enforcement guy, this was my #1 concern. Isn't it going to be too dangerous? Because as law enforcement officers, we're kind of trained that every scenario you walk into, you could be on the precipice of death or something horrible happening. So this was my biggest hurdle to get around. But what I found out, when we start looking at data, in Eugene, Oregon, the Cahoots program has been operating for 30 years, never had a single casualty or injury or even not even a close call for a civilian responder. Olympia and Denver have been operating their programs for less time, but they've had 0 safety issues as well. Within the last hour, I got off the phone. Amos and I were speaking with a mental health provider in Massachusetts, where we're doing working with an organization. And she said that they had been responding to behavioral health calls in people's homes without police since 2009, had thousands of encounters, and not one worker had ever been injured. So why is it then that law enforcement sometimes can make the difference? It's because the law enforcement uniform and badge often escalates the situation. From a law enforcement guy, it ends up being a reality. And community responders are trained. They're not just people off the street walking in and dealing with it. So when a situation is different than expected, or if it escalates, they can always step back and summon the police via radio communications. Still, fewer than 1% of calls in Eugene get referred to the police. And Denver has been operating for over 6 months, and they have not called for police backup a single time. And if you think about it, there are already civilians showing up to people's homes, these same addresses that we think necessitate a police response on a daily basis for other sensitive reasons. Child protective services, social workers showing up to potentially take someone's kid away. A utility worker showing up to cut off somebody's power or water, or an auto company showing up to tow somebody's car. And we're not getting reports of these individuals getting assaulted on a daily basis here. One of the critical things is dispatch, using critical thoughts, properly screening these calls, and Amos will kind of address that here in a few. But everybody here does recognize that there are calls for service, like someone has a firearm, or someone's assaulting someone, or a crime's been committing, where you do need someone to show up that has a firearm. But those are really, truly the exception and not the rule. I'll turn it back over to Amos here.
Thank you, Tom. So let's see. Now I think it's time, Betsy, if you can talk a
Yes,
little about
happy
the calls handled by, how many of these calls could be handled by community responders.
Absolutely. So, what is the potential for this kind of work? So based on our analyses, we've estimated that somewhere between 20% and up to 38% of 911 calls could be handled by community responders in the 8 cities that we studied. And then there's also another 14 to around a third of calls that could be resolved through an administrative avenue without dispatching anyone at all. So as Amos was mentioning earlier, these are calls like if someone needs to file a police report because Geico says they have to. And so I actually think it's very important to emphasize right now that we reached these numbers by working directly with people like Assistant Chief Thompson, who are very experienced police leaders and veterans, to get a sense of which specific types of calls they think could be safely and effectively handled by a community responder or by an administrative alternative. These numbers are very much based on the experiences of experts like Assistant Chief Thompson, who is able to really say with a lot of confidence where you do safely, where you do need a police officer to have a safe response to a call and where you might not. So there really is quite a bit of potential here. And I think Amos is probably able to speak directly to, what this might look like in a city like Dayton, which, has a lot of geographic and size-wise similarities with Akron.
Thank you, Betsy. And yes, here's the Dayton data. Sorry, it's not as pretty a slide. That's what happens when I do PowerPoint. So, we found that community responders, from a sort of mental health, addiction, homelessness, many co-occurring issues often, those types of calls, that was about 12% of the total calls for service that could be handled by community responders. Of course, there are other issues related to mental health. Let's say if a person has a weapon, where you would want a police response, but it's 12% just for community that would be appropriate for community responders. Then we found another 11% that would be appropriate for basically mediation type expertise. So this is again the landlord-tenant dispute, neighbor dispute, noise complaint, juvenile disturbance, those types of issues. Then there are calls where you want an officer to be there kind of right off the bat to make sure that the situation is secure and there is no immediate threat of violence. But then, assuming it's appropriate, the officer could call in the community responders to take over, because ultimately they're the ones with the expertise in the situation, freeing up the officer to move on to the next call. And that was 23%. So it's a very large percentage of calls, a lot of that involving domestic disputes where there's nothing physical, but you would want an officer to clear the scene, make sure it's okay. But ultimately the officer is not a marriage counselor or an expert. So if they're not going to take any action in a situation because nothing physical occurred, then what you really want is someone who is trained, has expertise to try to get towards a longer term solution, and not just wait until the call comes back in next week or even something more serious happens. And then finally, as Betsy mentioned, the report taking calls, those calls could be 29%. Then there's the alarm calls, and then the high risk around 20%. But the top level point here is that you got 23% of all calls for service, almost a quarter. This is a very large number of calls that could be handled by community responders in Dayton. Tom, I will turn it over to you. Let me see if I have another slide. Okay, this may be my last slide, but Tom?
Okay, I've got it. And so I just want to make sure you guys are clear on the fact that these percentages that Amos is talking about are percentages that have been very carefully screened, like every single call for keywords like firearms or assault or any type of crime, which is really what it takes to, you're not just broad brushing it. And the real experts are individuals that work on the data behind the scenes and help make it clear when we're looking at calls for service what we need police response to and what you don't really need police response to. So before I open it up to questions, Leap and Kat, we would both welcome this conversation to continue. We'd like that. We are engaging with different cities across the country individually to analyze their city's calls for service and perform some customized analysis and recommendations. And we would be happy to provide city-specific advice for Akron. Now I'll put it on mute and look forward to hearing your questions.
Thank you so much, Assistant Chief, and Amos and Betsy. Thank you so much. So I see we do have some questions coming in. So we'll start with Councilwoman Holland.
Thank you, Madam President. And thank you to the presenters. Very interesting information, and I really, really enjoyed your report. This is an area that's of great interest and utility. I can see a lot of potential for us here in Akron. And one of the things that I've been interested in for a long time, even before becoming a part of Akron City Council, is sort of, if you will, the cultural competency piece that goes with the role of dispatchers in deciding what a call is all about, exactly what they're hearing when someone is calling 911. So I guess I want to tie this to some of the data that you report in terms of numbers and percentages of calls that are coming in that could have been or were in fact handled by community responders. Are we looking at numbers that reflect self-referral? An individual calling in to say, I don't really need a police officer, I just need to fill out an accident report, Or are we looking at a decision being made by a dispatcher? And what are we looking at in terms of a different kind of training at the dispatch level, at the evaluation level?
Thank you very much, Councilwoman. I'm not very good with multi-part questions, so I'm sure I will forget some of the parts and then just fill in. Sorry about that in advance. So these are very important issues, and as you can imagine, we want to make sure. I mean, of course, training is essential both for the responder and for the call taker and the dispatcher. So what happens is the call taker is the person who you can only talk to one person at a time. And so the call taker picks up the 911 call, and then they're typing notes, and those notes are being read by the dispatcher. The dispatcher gets on the phone, with the officers basically. And so that's how, it's kind of what's happening within the dispatch center. And so I get very quickly drawn down into the weeds around how dispatch systems work. And the short picture is it's different in every place. I have no idea what it looks like in Akron. And so, a big part of what our work is with cities is diving into the details to figure out what is an approach that makes sense for a specific city. But what I will say is, the cultural competency training is incredibly important. I don't think that anyone on here will be surprised to hear that you could have two people call up the same dispatch center, the same dispatcher with the same exact comment, and based on how that person's voice sounds or the neighborhood that they're calling from, they're going to get a different, perception from that call taker about the urgency or danger involved in the call. And we work very hard, in terms of training around implicit bias, and also, in addition to the training, creating a protocol that lays out specific kind of a checklist, so that when you have a checklist, it's less up to sort of your own unfounded fears and biases in your head, and it's on paper. Okay, is there any indication of a weapon on scene? Is there violence that has occurred, or is there a threat of violence? Well, no, I checked those boxes off. Okay, if the person's not trying to report a crime that's been committed or anything, well, then I checked off the boxes. So that makes it easier. Of course, this is always going to be a problem, and it's something we need to continue to work on. But yeah, this is a very important problem. No one has solved this 100%.
Thank you so much. Do we have any other questions at this time? Councilman Malik?
Thank you, Madam President. Thank you to our presenters. I guess two questions that I wanted to raise. It's not a multi-part question, Amos. It's two separate ones. But from the presentation, it seems like, I know one of the things when we talked about in our Reimagining Public Safety meetings, we heard what Chief Thompson said, which is that a lot of officers say, look, any call can turn violent, or a lot of, there is that fear that there have been a lot of, you can truly never know, although it sounds like we have a lot of great data on how these programs have worked. But I guess it sounds like there's room for an alternative responder model and a co-responder model to exist together, right? That's the first question. And the second question is, obviously a lot of what we're talking about comes out of the last summer's protests and movement for racial justice. Can you talk about this model through kind of a racial justice lens?
We're all playing chicken to see if one of the
Oh, no, I'll take it if
panelists
you want me
is gonna
to.
jump in. Tom, go for it.
So part one, or the first question, there are places that both models exist. As a matter of fact, in Dayton, what we're working on in Dayton, they will have, there will be times where it's inappropriate for a co-responder. There'll be times where it's inappropriate for just a community responder without co-response. So I think it really comes down to Councilwoman Holland, you kind of hit the nail on the head. It comes down to really this dispatch screening initially. How well are we able to create a template so they know to ask the right questions so the right people go? But even still, you're still going to have a lot of times that communication is going to fall through the crack by no fault of theirs. And one entity may need to call the other on the scene, but a lot of times up front, you'll know, whether it's appropriate for just a civilian responder or a co-response. And then sometimes just the police need to go. There's that time too. So, I mean, that all comes through screening, but yes, they both do exist. A lot of these models were in place, not a lot. Some of these models were in place before the George Floyd murder, but it's become much more popular afterwards. And I do think racial justice is attached to it. And I very much believe that a lot of the cities that are trying to set up these co-responder models are trying to make sure that the appropriate responder goes to the appropriate call, so you don't escalate situations in communities where police response, their response alone can escalate the situation. And really, and I'll speak from the police aspect, we have a long way to go. The police do, and making sure that we are culturally competent, make sure that we are recruiting and retaining a police force that's diverse and looks like our community and understands context in our community. And as a whole, we're not there yet. And that's just the truth. And so I do think that both officers and communities can be put in situations that have bad outcomes when the officers are not the right responder.
And just to sort of tack onto that, I think Assistant Chief Thompson is absolutely right. And what I will say is I think this is a particularly unique opportunity because this is an opportunity to build something from scratch and to build something that's really uniquely Akron. There really are only so many models out there, and you have this opportunity right now to invite your residents to be part of shaping something new. We talk about reimagining public safety, but this is a real chance to bring people into the process of developing, finding out exactly what people in Akron actually want to see out of a first response, to figure out what kinds of calls they do and do not want the police to attend to be part of the implementation, and then frankly to be a responder themselves. I think it's really important to understand that, to think creatively about who is the right responder for this type of program. It very much depends on what type of calls you are going to be dispatching community responders to. But I think it's important to also remember that this is something that you can build from the ground up, from the hearts and the needs of your residents, and just like really keeping that as sort of the seed of what you're doing throughout the whole process, I think is what makes a lot of these programs either very successful or really, very responsive to the needs of the people on the ground.
Thank you. Councilwoman Amobian?
Trying to unmute. Thank you, Madam President. Thanks to the panelists. I work in mental health, and I have for the past 40 some years in Suffolk County. So I appreciate where you're coming from. I can only tell you that I totally agree that a number of things we have done for years. Before I worked in mental health, I worked in child welfare. So I have gone to homes to remove children. But in those cases, I always had an officer with me. And I know you probably know that we're very strong in CIT in Summit County and been training all the law enforcement divisions in that particular area. And it's been working extremely well for us. And many times the officer, or sometimes the officer who may accompany a clinician may be dressed in plain clothes, not necessarily in a uniform and that kind of thing. And sometimes, many times they are. Here's my thinking, and I do agree that there are many opportunities for clinicians to make these visits and interventions without being accompanied by an officer. But my only concern is that it only takes one major situation to occur where there's a problem. And then, we do hindsight. Most of your data that you collected, I'm assuming it was after the fact and not during or before, that you are looking at calls that went out and you're reviewing what actually occurred. I could be wrong, but if I'm not, please correct me. And because hindsight is always 20/20. So I'm just wondering, did you collect most of your data that way, or was somebody on the front end of these calls?
Sure. Yeah,
because there are lots of ways to to look at data and to figure things out. And how diverse is this? A team that works together across all these cities, and you do all this analysis and stuff, or do you have a group that will go to the city, or basically you do it virtually like you're doing today from different locations? So is your team diverse at all?
Great question. So the analysis in the report, this is data that it's actually open data. So we did not have to go to every city and get them to give us, make a request for a specific data set. They are very transparent and they actually make that data publicly available, which made it feasible for our very small team to virtually go and look at those, to get the data that is available publicly and then analyze it. It is publicly, so as far as your question about, hindsight, of course, you're absolutely right. It is so essential to, do everything that we can to avoid that disaster scenario that would, blow up on the news. And as far as the data, the data that we look at is of what the call taker is hearing from the person. And we do see, later on, okay, here, often that's also recorded in the notes as far as what the officer's experience was when they showed up to the call. But as far as deciding whether the call would be appropriate or not, we base that on what the call taker, the information the call taker had, because that's the only thing the call taker is going to be able to use to decide where to send the call. You can't say, oh, after sending an officer, we learned that it would have been appropriate for community responders. So we wouldn't count those calls where you needed the officer to go first. That's a very important question.
And ma'am, I would like to address that incident where something bad could happen. Working in the healthcare world, I got to watch firsthand officers interacting with behavioral health patients, CIT trained officers, and then mental health specialists. And I got to see, it was just an amazing difference in the ability for the mental health workers to outcomes were much better when they would work with our behavioral health patients. But if you think about when I look at the data, I look at it across the country, and even a conversation, like I said, I even had today, we have not found that there is these social workers or mental health workers are being abused. Matter of fact, I haven't heard of one. I'm sure it had to have happened somewhere, but outside of a hospital setting, I haven't heard of it. But I always try to balance that with what we do hear of quite often is somebody being shot by police because they were the wrong response. And so we still, you still have the opportunity for negative outcomes if the police aren't the proper responders. And I think the stat is individuals are maybe people dealing with mental health are 3 or 4 times more likely to be shot by police. And so you still are getting poor outcomes. And I'm not saying that, it's always possible for anybody to get hurt. And none of us want that to happen, but people are getting hurt. They're already getting hurt because we're having the wrong responders show up.
I wanted to, oh, I'm sorry.
I just wanted to
yes, go ahead.
make the one comment that when we invited the quick response team to come before our committee, one of the things I really appreciated about the team is that the team was comprised, it was a diverse team and racially and experientially. The thing that I loved is that they had a person with lived experience as part of the team. And I was quite impressed with how she talked about the work that they were doing with the officers, that it depended on the situation who would take the lead. And many times she would take the lead because, it was a drug situation or it was a situation that she thought she could handle based on the experience that she had when she was out there, in the world. And I just left with a real good feeling for how that is going. And again, I would imagine that your approach would include if an officer accompanied your team, they could always leave once they realized that they didn't need to be present. And I'm sure you're thinking of the officer didn't need to respond in the first place too, in some cases. But I was quite impressed with the way she presented many scenarios about how they have operated in Akron. And again, I know that there are many situations where you could have a community person who is very familiar with the neighborhood, with the residents and so forth, who could step in and maybe calm the situation down. But again, my only concern is when you have that one situation, then it gets blown out of proportion, but I'm sure that will happen.
Thank you, Council Member. I wanted to address that quickly. That's a very important point about, well, first of all, like our team at LEAP, for example, we are just making recommendations on the design, not actually doing the, on the ground training or the on the ground response. However, we do have a racially diverse team, a team with lived experience with these issues, although not on our not particularly on our panel today. But it is essential for when it comes to the actual responders themselves that that type of experience be considered. One of the big mistakes that we see cities making is they say, okay, we're going to write up a job description for the responders. Master's level, top requirement, master's level social work degree. It's like, you know what? You might need one of those people on the team, but you need experience in the community. You need people to reflect the background of the people they're responding to. And so a big part of our work is trying to make sure that cities don't create barriers that are going to lead to a really, monolithic group responding to these calls. We really want the responders to reflect the community, and that's a very important priority. And as you saw with the QRT team, that it impacts how well people are able to provide their services.
And I will say we've been engaging very closely with a number of cities are making sure very importantly to include and engage people with lived experience with whatever the particular type of call is that the community responders are responding to, lived experience with those issues on the community responder teams. And through these conversations, we really are kind of focusing on identifying those potential barriers to having a community responder team that reflects the issues and the people and, you know, the community at hand. So one of the things we've heard is, so for example, certain types of jobs that perhaps you need to use a police radio, or you need to be in a car that has a police radio, or you need to have some sort of access to a police system. There are certain background checks that go around with that. And for people who might have a experience with a substance use disorder, unfortunately, we know it's highly criminalized in this country, and thus they might have a criminal record. And that can sometimes preclude people from being able to access this kind of job. So working with cities to identify, you know, what actual barriers are in place that are, you know, potential just collateral consequences that they don't truly need to include in that job description, or in how to kind of bypass some of these things to make sure we are engaging and bringing in really the right people with the right lived experience without instituting these sorts of unnecessary barriers that can really kind of, as Amos mentioned, sort of compound and exacerbate some of the disparities that, of course, we're already seeing.
Okay. Thank you so much. I saw Councilman Fusco.
I think he left. That's
Okay.
what
He's back in now.
He's back in. Okay, I saw his hand.
Oh, okay. I'm sorry.
Councilman Fusco, can you hear us?
I can. I apologize. I've been in and out all day on every committee. I'm so sorry. I'm going to really talk fast because I may go out and I missed a lot of this, and I'm sorry for that. But I want to welcome everyone and thank you for coming in. Certainly appreciate it. My question, very briefly, is this model that we're talking about, how new is it? Is there other cities out there who?
Okay, looks like we've lost Councilman Fusco again. So we'll actually go to, is there anyone else that has a question that hasn't had an opportunity to ask a question yet? All right, so in the meantime, give Councilman Fusco a little bit more time to get back on. Councilwoman Holland?
Thank you, Madam President. I'm looking again at this paper from two of our presenters, and I'm really interested in the idea of the credible messenger. I had an experience just this morning that involved sourcing or attempting to, we're kind of in the middle of doing it, some information about someone who was picked up this morning. It's a complicated story. I'd be more than happy to fill in fellow council members offline, but just sort of cut to the chase. This was an experience happening in real time, not yet concluded, where the efforts to sort of connect up members of the community who are not necessarily wearing uniforms, but who might be able to allow, I guess, provide some context to this individual and the circumstances that led to this morning's situation. I saw this happening, and it was powerful to see. And it was not necessarily an organized or formal process. It was just really good community effort. So as I was reviewing this paper in advance of this meeting, credible messenger jumped right out at me. This idea that we have these trained professionals from, clinical care. We have our law enforcement officers, and then we have engaged citizens. Wondering if the panelists could just say a few words about this. I think it's powerful stuff.
Absolutely. And I think you hit the nail on the head. The idea here is to institutionalize and to systematize a system that is actually really already happening in a lot of cases on an informal basis. You see examples of credible messengers. So people who have experience in the community, deep connections to the community. It's a term that's often associated with violence interruption, but really is that's just sort of one role that a person with that kind of credibility can play. But you do see credible messengers playing this role informally in the community all the time. I think some really powerful examples that have actually come out of the pandemic. We've seen, for example, the city of Newark early in the pandemic when, we were all just sort of becoming accustomed to the social distancing restrictions. There were, groups of kids gathering in sort of violation of, however many the limitation was at that point. And at that point, I think we've all seen the reports that there was a lot of criminalization of that, particularly for communities of color were being sort of disproportionately hit with citations and arrests and whatnot for violating social distancing. So instead of dispatching the police to tell the kids to break it up or whatnot, the city of Newark was dispatching credible messengers from their violence interruption team to explain to the kids, why it's important to adhere to social distancing and why they should be wearing a mask, and using this as a kind of a teachable learning experience from a person who they're going to listen to, as opposed to, they are perhaps less likely to listen to it, an officer in a uniform, just sort of given the dynamics. But when the person, who has that connection to them and to their community comes out and explains this to them, not only are they not getting hit with a citation or an arrest that really is counterproductive, but also there is that opportunity for learning. So I think that this is work that's already going on, but we need to start valuing it, and we need to start, bringing it into the fold as a really positive and powerful solution.
Okay, thank you so much. Councilman Freeman?
Yes, kind of a two-part question. First of all, have you had any experience of residents, when someone shows up and they're not in a uniform, have you had any experience of folks saying, look, I called the police, I didn't call these folks? I'd like to hear a little bit about that. Anyone?
I'd be happy to jump in on that, but I don't really have any. I don't have any concrete examples. It's something that I'm sure it happens. We have not heard of it being an obstacle to the program's success. But as you can imagine, community education is very important, because some people are going. We've all been programmed to, well, if it's serious, then the police come. And if the police don't come, you're not taking it seriously. And so it's very important to get the message out there that serious doesn't mean police. Serious means a person who's best suited to actually deal with the issue. And that's not always police. And so it hasn't been something that we've heard from any of the existing sites that they had specific issues with that. But of course, their success is really dependent on, educating the community about what is this program, getting the story out there to the public so people understand and aren't totally taken aback by, who is this guy in a sweatshirt showing up on the scene? I was expecting an officer.
Okay, and then the second part of my question, it may apply to you folks. It may be just something. I'm going back to when I had brown hair, and we had 25 plus years ago, we had can't remember the name of the program now, but it was a very, very aggressive housing program that dealt with bad houses, and some of our inspectors didn't have policing powers, but got pretty aggressive, and there were some bad incidents, and so the program eventually was shut down. I would just think that an integral part of this would be, training the responders, as well as, I think what you just said, training our citizenry as well. I know the folks that show up, the more they know, and the more the folks that they're showing up for no, it seems like the better this would work.
Absolutely. I mean, I think training, that I don't think anyone is proposing dispatching, as Amos mentioned, or maybe it was Assistant Chief Thompson, just, people off this random citizens. I think it's like the training piece of this is absolutely critical to the success of community responders, making sure the people you're dispatching are trained professionals who know exactly what they're going in to do and have a very clear mission and very clear training that aligns with that mission. I think is incredibly important to making sure that a program doesn't fall victim to exactly what you were just talking about.
Okay, thank you.
Okay. Well, thank you so much. I don't see any other questions at this time. I want to thank our panelists for taking out time and sharing this conversation. Has been very informative. So thank you so much. To our committee, I want to let you know that we do plan on meeting again on next Monday. We will actually have Dr. Erickson come before the committee, and she will give a final report on our community engagement component that the university helped us with in terms of reimagining public safety and hearing from the residents here in Akron. So we look forward to hearing her report on next Monday. Actually, Shamus is correcting me. That's in two. Oh, no, he's telling me something else. Shamus is giving me more information. All right. So Shamus also wants me to let everyone know, which is very true. I guess Dr. Erickson is actually in 2 weeks. So actually next Monday, we'll actually hear from our police leadership and be able to have some conversation with them in terms of gun violence and I think some other updates that they want to share with us. So Dr. Erickson will actually be in 2 weeks. And we'll hear from police leadership actually on next Monday. Is there anything else coming before committee at this time? Seeing and hearing none, can we have a motion for adjournment? Oh, I think Councilman Malik has something.
Sorry, I know Councilman Fusco had a question, but I think he left, so we'll just make sure to get that addressed.
Yeah, we'll get it. Thank you so much. Can we get a motion for adjournment?
So moved.
Is there a second?
Second.
Okay, meeting adjourned. Thank you so much.
Thank you all.
This is our final committee meeting for the day. Council will meet at 7 p.m. tonight. Thank you.
Let's see here.